Today we are tackling two of the most popular cosmetic procedures out there. Botox and dermal fillers, often talked about in the same line. They actually work in very different ways. We'll break down the science behind each, clarify their distinct uses, and perhaps most importantly, debunk 13 common myths surrounding Botox. So if you ever been curious about these treatments or felt a bit speechless by this information out there, you're in the right place. Let's dive in. Let's start with the basics. While both Botox and fillers are injectables used to address signs of aging, their mechanism of action and concerns that target are quite different. Botox is a neurotoxin produced by the bacterium Clostridium botulinum. Now don't let the word toxin scare you. When used in controlled tiny doses by trained medical professionals, it's incredibly safe and effective. Botox works by blocking nerve signals to specific muscles. When the signals are blocked, the muscles can't contract as strongly, leading to a temporary relaxation of the targeted area. Botox is primarily used to treat dynamic wrinkles, those that appears when you make facial expressions such as frown lines between the eyebrows, forehead lines, and wrinkles around the eyes. The effect of Botox are temporary, typically lasting about 3 to 4 months. As the nerves ending regenerate, muscles actions gradually return and the wrinkles may reappear. Dermal fillers, on the other hand, work by adding volume beneath the skin surface. They are gel-like substance that injectables to fill in wrinkles and folds, enhance facial contours, and restores lost volumes due to aging. There are various types of dermal fillers available, but the most common ones are made up of hyaluronic acid. Hyaluronic acid are naturally occurring substances in our skin that helps you keep it hydrated and plump. Fillers are used to address static wrinkles, those that are visibly even when your face is at rest, such as nasolabial folds, the lines between the nose and your mouth, marionette lines, that is the lines from your mouth to your chin, and to add volume to the areas like the cheek, lips, and under the eyes. They physically plump up the skin and underlying tissues, smoothing out fine lines and restoring youthful contours. The longevity of fillers varies depending on types of fillers used and individual factors, but they generally last from 6 months to over a year. Botox relaxes muscles to smooth dynamic wrinkles, while fillers add volume to fill static wrinkles and enhances contours. They addresses different concerns and works through distant biological mechanisms. Debunking 13 Botox myths. There's a lot of misinformation out there, so let's separate facts from fiction backed by scientific and understanding. Myth number 1. Botox is a toxin that will poison you. The fact is, as we discussed, Botox is derived from the neurotoxins, but doses used in cosmetics procedures is extremely small and highly controlled. It acts locally at the injection sites and does not spread throughout the body to cause systemic poisoning when administered correctly by a qualified professional. The safety profiles of Botox is well established through decades of research and clinical use. Myth number 2. Botox will make you look frozen and expressionless. The fact is, this is a common fear, often restricted, outdated techniques or over-treatment. When administered skillfully and appropriate doses, Botox should relax specific muscles while allowing natural facial expressions. The goal is refreshed and smoother appearance, not a frozen one. Choosing an experienced and qualified injectors who understand facial anatomy and aesthetic is crucial to avoid this outcome. Myth number 3. Botox is only for older people. The fact is, while Botox is often used to treat established wrinkles associated with aging, it can also be used to preventively younger individuals also. By relaxing muscles that contribute to wrinkles formation over time, it can help slow down the development of deeper lines. The decision to start Botox depends on individuals' concerns and the advice of a qualified professional. Myth number 4. Botox is painful. The fact is, most people experiences minimal discomfort during Botox injections. The needles used are very fine and the injections are quick. Some injectors may use topical numbing cream or ice pack to further minimize the potential discomfort. This sensation is often described as a brief pinch. Myth number 5. Botox are permanent. The effects of Botox are temporary, typically lasting 3 to 4 months. The body gradually metabolizes the botulinum toxin and the nerve function returns to the treated muscles. To maintain the results, repeated treatment are necessary. Myth number 6. Once you start Botox, you can never stop or your wrinkles will get worse. The fact is, there is no scientific evidence to suggest that stopping Botox treatment will make your wrinkles worse, and they would have been naturally. When you stop, the treated muscles will gradually regain their full activity and wrinkles may appear over time as they naturally. Myth number 7. Botox can fill lips and cheeks. The fact is, this is a common misconception. Botox works by relaxing muscles while fillers add volume. To enhance lips or cheek, dermal fillers are appropriate treatment, not Botox. Using Botox in this area would not achieve the desired volumizing effect. Myth number 8. Botox has serious long-term side effects. The fact is, Botox has long and well-documented safety records. Serious long-term side effects are rare when the treatment is administered correctly by a qualified professional. The most common side effects are temporary and localized to the injection sites, such as mild bruising, swelling, or redness. Myth number 9. You can buy real Botox online or at home. The fact is, authentic Botox is a prescription medication that should be administered by a licensed and trained medical professional in a clinical setting. Products claiming to be Botox sold online or at home are likely to be bogus, unsafe, and potentially harmful. Always ensure you are receiving genuine Botox from a reputable provider. Myth number 10. Botox can fix all types of wrinkles. The fact is, Botox is most effective for dynamic wrinkles caused by muscles movement. It has limited effect on static wrinkles, deep folds, or wrinkles caused by sun damage or loss of collagen and elastin. In these cases, derma, filler, or other skin rejuvenation treatments may be appropriate. Myth number 11. Men don't get Botox. The fact is, this is an outdated notion. More and more men are turning to Botox to address signs of aging and achieving more refreshed and youthful appearance. The principle of Botox treatments are the same for men and women, although injections techniques may be referred to masculine facial features. Myth number 12. Botox injections are all the same no matter who does them. The fact is, the skill and experience of the injectors are paramount to achieving a natural looking and safe result with Botox. A qualified professional has the deep understanding of the facial anatomy, muscle function, and injection techniques. Choosing an unqualified or inexperienced injectors increases the risk of complications and undesirable outcomes such as asymmetry or a frozen appearance. Myth number 13. Botox is incredibly expensive. The fact is, the cost of Botox treatments can vary depending on treatments like area being treated, number of units required, and the provider's fees. While it's an investment, many people find it to be a worthwhile expense for the aesthetic benefits it provides. It's best to consult with a provider for a personalized assessment and cost estimate. So, as we can see, there are a lot more to Botox and fillers that meets the eyes. Understanding the science behind these treatments and being aware of common myths is crucial for making informed decisions about your cosmetic options. If you are considering Botox or fillers, the most important step is to consult with a qualified and experienced medical professional such as dermatologists, plastic surgeons, or a licensed aesthetic physicians. They can assess your individual needs and goals, explain the different treatment options, help you determine the best approach for you. Don't hesitate to ask questions and ensure you feel comfortable and confident with your chosen provider. That wraps up today's deep dive into Botox and fillers and our myths busting sessions. I hope this information has been helpful in clarifying the differences between the treatments and dispelling some of the common misconceptions surrounding Botox. Remember, taking care of your skin and exploring cosmetic options is a personal choice and essential to do your research and seek professional advice. If you enjoyed this video and found it informative, please give it a thumbs up, share it with anyone that might be interested for more science backed and health beauty contents. Thanks for watching, and I'll see you in the next video.